It's a complete honor to be interviewing you today and getting the chance to delve deep into the workings of Humanity Crew, where we are changing lives of victims of humanitarian crisis. That is something very sensitive and very important given the time that we are right now. So I was really very curious to know how this all works and what has gotten to this point. So we have curated certain questions that will help us understand maximum about the organization and about you in this limited amount of time.
Yeah. So thank you so much for that question. Actually, mental health is a big concept, and that lately has been more trend, because before I would say that in maybe 10 years ago, now that is coming that, okay, mental health is important. Before that's like, okay, so physical health is important because we can see it. So it's like the behavioral part, right? Like, yeah, so if I break my leg, you can see it. And then you put something to help me. But sometimes we have other things that are broken that you cannot see. And it's hard to somehow grab what is happening. Mental health is, I would say, is everything. So it's the emotional, psychological, spiritual, so this social well-being that we have in our life that is affecting everything that we do, how we process life, the connections that we do with others, and the way we work, the way we love, the way we do everything. So right now, I think it's especially important. Well, it's always important. I must admit, it's always important. But now that we're going through everything that is happening in the world and that we have so many people working on that, it's very important to create awareness around that every one of us is a mental health person. Like we can all do something for the mental health of others and the community that we are living in, okay? So that's actually one thing I wanted to transmit in this interview, that this is not something that just the psychologists do. This is not something that just the people that is having mental problem is dealing with. Mental health is everyone's business, everyone's, okay? What we had in COVID, well, actually, what is now the consequences of COVID in mental health, is that we have a lot of people that feel a lot of anxiety, a lot of depression, it's very hard to see it. Like I can see I work with a lot of patients, and I can see the impact that it had on how people process life, because then one of the biggest protective factors that we have as human beings is the connection that we have with others. So we are actually social beings. We're biologically created to be in tribes. And then when we found each other is that from one moment to another, there were people that were literally without their families. We had people that their families, some family members were dying and they couldn't hug each other because it was dangerous. So it looks like it's something small, but not being able to hug your mom if your dad died is actually very, very hard for the brain to process, the brain and the body actually, because then you're not doing what the body is asking you to do, okay? And that has a lot of consequences, okay? Because then we have people that feel emotions, have the sensation in their body, but they don't do what the body is asking them to do, and then we have a lot of blockages, a lot of problems connecting with others. So it's actually very, very hard to grab everything that is happening, okay? And now with also the situation in Ukraine, Humanity Crew especially is looking at children, because although mental health is throughout the whole life, children are especially vulnerable to what is happening to them. It's like when we are children, because we all were, we are like sponges, and depending on the story we're telling ourselves about what is happening around us, it will dictate a lot how we're going to be as adults, okay? So yeah, I would say that's pretty much what I would say is mental health. Like we can go deeper, but yeah, that's different, very complex, very, very interesting and very beautiful part of our life, that without it we don't have pretty much anything. We don't have the tool and the channel to process life.
That was probably one of the quickest and most to-the-point explanation of mental health that I've heard so far.
Thank you. It's hard to explain.
I know it's hard to explain, but then you said it so perfectly. Now, the thing that you mentioned, that kids are like, I'll start from the last point that you talked about. So you said that kids are more vulnerable and they should be we should be paying more attention to them, because obviously that's the time when their subconscious mind is getting developed till the age of 5, and even till they attain pre-teens, they are still very vulnerable, and they're like the sponge who absorbs the whole environment, and that kind of sets the base, on which their whole life is dependent on. And really, and then that's also a very terrible part where most of the refugees that we have are children. So that's again very scary.
Yeah, actually, the half of the 82 million refugees right now are children. It's actually a big number, very big number of kids around the world right now having situations that they don't have the tools to process it.
And imagine they are a future generation who will be carrying forward this world, and they are going through at such a vulnerable time of their life.
Yeah, totally. So it's a whole generation.
Exactly. And the part where you mentioned that our mental health gets affected when we do not do what our body is asking us to do, that is something that's not realized. I just realized it, and that's correct. Like mind body coordination, if that goes out of balance, your mental health starts getting affected out of it. And so the part where you talked about community, I'd like to know more about it. Like how mental health of one person or mental health of a group can affect the overall quality of the community. What do you think about it?
So how the mental health of one person can affect the community? That's what you mean? Yeah. So actually, there is a beautiful way to see it. That is with the system approach. So we are all part of something bigger than us. Okay, so we are not neutral beings. We are part of it. So like actually, for example, I have a relationship with my family and I'm part of it. And if I weren't be part of my family would be completely different. Yeah. Even I have a relationship with myself. I'm a system with myself. Okay. So the way I treat myself is also it's also a system. Okay. It's also impacting different part of myself. So the way a person is going through a mental health problem or just having a specific situation will impact without question the way the different communities work and process life. Okay, so for example, one thing that we're seeing a lot in the refugee camps, for example, in Greece, in the border of Poland and all that, is that so when you can attend individually is cool, so it's very important. But when we can create a community, a group of people that can hold a person, is a completely different situation. Okay, so we have, for example, if we have, let's say, a person that is very depressed and need individual help, of course we can provide that. But then, for example, the fact that we don't have that many mental health providers, sadly. I think the world should go there, like educating people to be mental health providers. But now that we don't have that much, one of the best tools that we have is the community. So the community heals, the community holds, and that will allow cases that are not that bad, so like are not like saying suicidal thoughts or in a deep depression or in a deep anxiety attacks, that will allow the person to process what is happening, because also it's seeing that others are going through the same thing that I'm going, so I don't feel alone anymore. Okay, because trauma is not what happened to us, it's how we process it. Yeah, so it's very important that, okay, so for example, if I'm in a group of kids and they all went through something similar, and then you put them together and you make them draw what happened to them, and then when they're sharing, they look alike, you also put this up, and then they start talking about it, and it's like there you create humanity, there you create what the person needs in order to feel held by others. Okay, So yeah, individual health is important, but I would say that you cannot separate individual health from the community health, and mental health in this case, as you cannot separate physical health from mental health. So it's very hard to find the borders or the what is one thing and what is another thing. It's very weird that you find a person that is perfect in mental health in a community that is going through a very hard time. It's very weird because they're completely you can see the feedback between the two parts, okay, and the affection that they have between them. I would say that's my
Exactly. So, like you correctly mentioned that it's all interrelated, and while I'll be taking care of the community, at the same time I cannot ignore my mental health, because that will directly or indirectly affect the people around me, and then it will have a snowball effect and then affect even more people. So you mentioned where kids are sitting together and how they support each other. So when we talk about community like this, how does humanity crew help the refugees, help the people, help the children through their mental health journey?
Okay, so answering the question, how is humanity group helping right now, and what's our, let's say, our labor in the world? So what we do is mainly two things. Okay, so we do the emergency mental health psychological support services. Let's say that we just go there with the people in the team. So we give the support that the people need there on the field. Okay. So yeah, it's different. There are different way of doing it, but mainly it's this emergency attendance. Okay. And then we do the expert training. That is one of the things that I do the most. Expert trainings and cultural workshops, okay? Because when we are talking about refugees, we're also talking about cultural shock, okay? And sometimes we find in different cultures just coming together, and it's very important to hold that diversity and understand that, so we don't make the culture shock the situation worse than it already is, okay? So we also do that part of the cultural mediation workshops. And the expert training is what we do to the aid workers and volunteers, that we train them around mental health, about ways of communicating with refugees, about understanding the way they're coming to the camp, because they're coming with a big bag, a big thing. So they're not coming neutral to the refugee camp. And that's, for example, something I did for the aid workers and volunteers in Brazil that are receiving the Venezuelan refugees. And we were talking about assertive communication, emotional intelligence. We were explaining to them the different phases where the refugee goes through, because they are in a fight-flight mode pretty much all the time. And there is a very illustrative example will be like, for example, when they're arriving, it's very common that they're aggressive. Okay, the refugees are aggressive because they're in this flight mode, and anything will be taken as a threat. And actually, I put myself in this situation. I will also feel like everything is a threat, because in their universe in that moment, everything is a threat. Okay, so they are just somehow looking for a way to survive, not to have good connection to others. It's just, I need to survive, I need to arrive. And depending on the journey that they have gone through, we can be talking about months of walking, of going through terrible situations. So it's very important that the person that is receiving this refugee knows with what this person is coming with. Okay? Because, for example, if they're coming and they're very aggressive, for example, and they have to do a line to say their names, and then you ask them, hey, can you go to this line? And they start like, don't talk to me like that, don't shout to me. If the volunteer doesn't understand what is this person going through, maybe will react from defending themselves, like, hey, don't talk to me like that, what's wrong with you, blah, 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 blah. So if they understand that this person is talking from a flight mode and everything that it means, knows that the way of talking back is not from a high voice, but actually lowering it, look into the eyes, holding, like, come with me, I will guide you through the line, what do you need, there's something I can do for you. Because then you are putting their system down. It's like somehow like calming their system. You're passing from this more fight flight to rest and digest, right? Like we're giving them a different option. Because until now, it's true that their universe and their life has been very, very hostile. Okay? So yeah, that's pretty much what we do. As I said, that's a little summary. We just like intervene directly. So we send people from the team to directly attend the mental health problems. But as I said before in the other question, we don't have that many people that knows or that are psychologists or psychiatrists. So it's important to do the second part, that is this training, right? Like understanding that we are all mental health beings, like agents, okay? So yeah, that's what we do.
Thank you, Iara. Since I would say the beneficiaries who you deal with are very sensitive, right? Because they come from different cultures, different countries, under very, very serious circumstances. And I think it's very difficult for someone who has not been in that position to empathize. So as someone who is, kind of intervening directly with these people, I just wanted to understand if you could think of a few things that you wish more people knew about mental health of refugees. Maybe how to approach them, how to be more sensitive in terms of interaction or at a policy level. So, yeah.
Thank you for that question. Yeah, definitely there are a lot of things that come to my mind. And first is that everyone is, I think that's a very nice thing to have in mind. Everyone is battling something that you cannot see, right? So we're all going through things. Even the person that looks like nothing is going wrong, there is something that is happening, okay? The person can be handling it better or worse, but it's something that is happening. So that's why we from this mental health awareness, what we are asking for is be kind, okay? Like think the most generous situation that the person must be going through, okay? With this I mean, for example, in little things. Maybe you're in your car and you're going to your work, and then someone comes and just, it's I don't know how to say that in English, but you don't see the light. You don't see the light, and the other person does see the light and just cross and almost creates an accident. You can think that the person is super, the worst person in the world, that is super violent. You can see you can think the worst of that person and enter yourself in that feeling of anger and insulting. Or you just can think, well, maybe the person is in an urgency and going to the hospital because someone in their family is sick. You will never know what happened to that person. But the internal process that you go through with the different thoughts is completely different. Because then you empathize. You empathize because we all have families that we love. And if we think about someone that is maybe in a rush to go to the hospital because someone in the family is sick, you can say, okay, you know what? Nothing happened to me, I'm fine. Maybe I got a bit scared. I can regulate my system, I'm fine. I hope that you arrive wherever you're going in safety, right? Just this small thing. And with this thing, we can go to literally everything. Thinking the best and the most generous situation for that person that you are dealing with. Another thing that I would say is that nothing is personal. So that helps a lot. And it's very related to this topic. Like, let's try to come from the point of curiosity when we are dealing with other people and their life, especially with refugees. Okay, we have refugees. So it's very complex because we have, as I said before, 82 million people right now that is forcibly displaced from their country. So that's a lot of people. That means that if one person is a universe, so we're talking about 82 million people. So it's very also interesting to look at every case if it's possible. But in general, we're talking to people that have gone through a lot and is going to go through a lot. Okay? So it's very important if you're going to be in contact with people like this, nothing is personal. Like whatever they're telling you, whatever that's going to happen, try to take the best out of it, because then you are taking a decision from a place of privilege that you want to help. Okay? And that's like whatever the person said, like don't come to that place that, oh my God, I'm trying to help, but look how they treat me. It has nothing to do with you. Like they literally cannot do it better right now because they're dealing with too much. Okay? And another thing I would like to say is that because mental health is so important, I say that if wherever you're living in the world, talk about mental health. Like, get curious, read. If you can do any, like, promote that the governments or the community invest money in the mental health of the people that is there, because in long term there will be, not even in long term, we're talking about short, mid and long term, we're going to see results that will impact everything, economically, socially, everything. So I think that just being that agent that makes the difference, that look at the situation with curiosity, and of course, that's like the top one thing that I will transmit to others: work on yourself, like work on your own mental health. You cannot give to others what you're not giving to yourself. And of course, we're driven to help others, and that's a beautiful thing to do, and that's part of being human. The problem is that's the only thing you do, because then you are not taking care of the main tool that is you, and the main the main experience is yours. So from that filled cup, you can give to others. Okay? Because what we have right now is that people that, it's beautiful the work that a lot of people is doing, but then they come to burnouts, they have anxiety attacks, because they're not taking care of what their body is telling them. That is, hey, look here, we need also our spaces, we need also to put our limits, our boundaries, right? Like, we cannot be 24/7 to others. Where is the rest? Where is the taking care of the little moments? Where is the family, the system, you know? There is so many things that will allow us to have these protective factors, that I think that's another thing I would like to that's one thing I had in mind to tell you. An easy way to look at mental health, or how we can work with mental health, is with protective and risk factors. Okay? Everything can be or a protective or a risk factor. Like, it's actually quite, you can have neutral ones, like, I don't know, not even, I would say the weather, but the weather is also a protective or a risk factor. Because depending on their mood, if you are in a bad mood and you don't have the best day and it's raining a lot and you cannot do things, it can affect as well. Or the vitamin D, everything can actually affect. So when you are in a situation, it's very important that it's evaluated or assessed the protective factor that a person has in a specific way. Okay, for example, if we have a kid that is a refugee, but the kid is with his family or her family, okay? It's not the same as a kid that is alone. So we have a protective factor here that the opposite is the risk factor here, okay? And in that sense, we already have a lot of information how this person can react to life, okay? And that's when, system, but then it's also like the health, like the physical health, the education, that actually there's a lot of protective factors that I will invite everyone just to go online, protective factor in mental health. They can see the list and assess the other people's situation in that sense, okay? Because a person that is a refugee right now has 3 times more chances to develop anxiety and depression, or another poor well-being state, than a person that is not. So we need to be very aware that there is a lot of fragility in these situations. But I'm not saying that the person that is a refugee has not the tools or resources inside of them that will allow them to develop this resilience that we all human beings have. But it's important that as a community, as the person that is looking at them and tending to them, knows that there's fragility without these protective factors. That would be it.
Thank you, Iara. That was a very, very elaborate, I think, not just list of things that people should know, but also ways that they can help refugees. And I think one takeaway that I have from this is that be curious instead of being anxious when it comes to refugees. If we are more open-minded, I'm sure that people have a lot to bring in, and there's a reason that they chose to come to, a particular country, because they want safety and they want growth. So a lot of times people are insecure about refugees, that they'll take jobs and they'll take shelter and resources. But if we really think about it, I mean, they'll bring human resource, they'll bring skills if given the right platform. So Now I just want to shift the gears a little bit and understand specifically how can people help your nonprofit. Um, you mentioned a lot of things that your nonprofit does in terms of direct intervention, and you did mention that you don't have a lot of people at the moment. So what are some ways that people can reach out to you virtually or physically and help refugees?
Yeah. Actually, my answer will go more that do locally what you want to see in the world. So Humanity Crew right now is working more online. So actually all of us are all over the place. Like I'm in Spain, the main director is in Israel, then we have a person in New York. So there's different people all over the place. And what I would say is that how you can help us is working locally, like actually reading about mental health, getting education, let your curiosity lead you to understanding more the human, I would say behavior, but not human emotions, human behavior, human spirituality, like getting curious, working on yourself, because once you work on yourself, you want to work with others. That always happens. Like it never happens that you work on yourself, like, I don't care about others. No, it doesn't go like that. So it's very important that, like, get this curiosity, work locally. There are a lot of things you can do locally. Like where there's people that you can help. So go to like, I don't know, do your research, which are the maybe non-profits that you have on your community that you can help and go. Break stereotypes. That will help a lot, because I think that one of the main problems with that the refugees go through is this prejudices, or the stereotypes that they have around them. It's so sad. It's so sad to see that they have a lot to go through, and then the other people, because of their closed mind, they just put some labels on them and give them less opportunities. Because then you were saying that there's this belief that they will take your jobs or they will bring violence, and that's just a belief. That's just a belief, because then these are just human beings that want a better life that we all deserve. Like actually tackle into dignity. Like because they were born in a different place, that doesn't mean that they have less right to live a dignified life. So like this work on yourself will allow you to see that they are as important as you are. Why you in your warm bed have more right to have that bed than the other person? They didn't decide to be born in the place they were born. They just were born there. So what can you do from that privilege that you have? Because then one thing I love to see is that when we have privilege, we have responsibility. There's no way to have privilege without responsibility. No way. So if you have that privilege, do something with it. You will feel great, I promise. Like there's no way you will feel bad about this. If you use your privilege, you will feel awesome. So do it for yourself as well. Like even just, you will do it for others, but you are doing it for yourself as well. And you can also go through Instagram and share our posts, or mental health is everywhere, actually everywhere. So my message, and I would say that I'm talking for all Humanity Crew team, is that mental health is everywhere. So go and find it and do something about it. Not with us necessarily, but do something about it with yourself and the community you are living with.
Thank you, Iara. I think that was a beautiful message, and I love how you focus and emphasize a lot on contributing locally, and how it does not require a lot of time, a lot of effort. It just starts by curiosity and learning about mental health. So thank you for that. That was a great message.
Nice.
And with that, we come to the end of this interview. It was great chatting with you with what little time I had. And thank you for giving us your time, and Humanity Crew for choosing us to interview for this campaign.
Perfect. Thank you so much.